What if the future of medicine wasn't about treating symptoms, but about predicting, personalizing, and preventing diseases before it even begins? Today, I'm joined by someone who is truly at the forefront of that shift, Dr. Erika Tajra. Dr. Tajra is a physician trained in the UK with a background in family medicine, advanced research in pediatric genetics, and a deep specialization in the personalized and functional health medicine space. Her work spans everything from genetic sequencing and microbiome analysis to fertility optimization and longevity protocols, helping patients move from reactive care to truly proactive health. But what makes Erika's approach so powerful is that she doesn't just study this, she lives it. After navigating her own health and fertility journey, she developed a personalized, data driven roadmap that not only transformed her health, but led to a thriving practice helping women, families, and even fellow physicians take control of their biology. Now she's expanding that vision globally, building a network of doctors across multiple countries and developing an AI platform designed to make personalized health accessible, scalable, and affordable for people around the world. In this episode, we're going to dive into how genetics and environment truly shape our health outcomes, why fertility and longevity are more connected than we think, the gaps in traditional healthcare, and how we can rethink the system. Also, how AI is becoming a powerful tool to democratize personalized medicine. This is a conversation about courage, innovation, and what it really looks like to reinvent medicine from the inside out. Please join me in welcoming Dr. Erika Tajra. Welcome,
Hi.
Dr. Tajra. We're so excited to have you here. I mentioned to you a little bit in our pre-chat that I just woke up this morning so excited for this conversation. So
Thank you for the lovely introduction.
thank you for joining us. So tell us all a little bit more about what you're building right now and what your journey was that brought you to this point.
Okay, so in terms of what I'm building right now, I have two things going on at the same, like in terms of business,
Mhm.
private practice with a global, mindset of, allowing me to work with patients in different parts of the world and clinicians in different parts of the world. And at like the AI chat health coach that we're developing side by side. So these are two things, different things, but it all comes from the same knowledge. So the app is, not everyone has access to a functional medicine doctor or is able to pay for that because insurance doesn't cover that. And in developing countries, definitely that's, in a lot of countries, that's not a thing. So if you look at ChatGPT, we always talking with ChatGPT, and if we use such tools where I can provide the things that I know and the person can have access to that, so it's like an AI version of me, where we kind of genotype people into 6 groups, and it's an estimate of your biology, and it's good enough in terms of the personalized functional medicine approach that I have. So what it's in my brain, I've been trying to fit into this chart. And then so you have an AI version of me that would be cheap for people to use. That's one product. That is the product. And my private practice, which is working with doctors in different parts of the world, as I told you, here in California, in the UK, Barcelona, London, Australia, and Lisbon. This is where we are right now. And we have someone who has just joined from Brazil. So meaning you have someone locally who can prescribe or guide you with certain things, but I can give the support in terms of longevity, genetics, microbiome, that part from, anywhere really. So we just had to just do it and ignore the system and just do it.
Right?
Yeah. And you asked about how I got here, right?
How you got here? What was your journey? I know it wasn't anything but traditional, the journey that brought you to where you are now. So if you don't mind sharing that with everyone, I think that's one of the most interesting things. And I find that so often when I'm talking to people, particularly in this space, it is that they either had to heal themselves or someone close to them first. And that's what brought them to where they are now.
Yeah. And this, you're absolutely right. And even the great, amazing functional medicine doctors that we see out there, especially here in the US, right? A lot of them, they have a good story behind. They went through something. So for me, I'm Brazilian. I immigrated to Portugal and then to the UK. And then I went to great private schools as a kid, but then my parents lost everything. So I had a lot of that in my life, having things and then losing them for a period of time to point me the right way. So instead of complaining, I've decided to say, oh, this is good that this happened to me. So psychologically helps me. So I had to work as an immigrant to save money to go back to school, because then I couldn't afford to go to medical school, and had to help my brothers to finish school because they're younger than me. So I did that. That was a great lesson for me about life, because, I was at my parents' house and had a privileged life. So I've learned a lot there. Then I went to medical school in the UK, in one of the best medical schools ever, because it was inside of a hospital. So we are with patients from day one, which is not day one, year one. It's amazing. It's a privilege, really. And I wouldn't have had that chance if I had stayed at home with my parents. And that gave me a really good clinical, base. But when I joined the working force, attention, I was already a mature student. So you see the world with a different perspective, right? Go to hospital and then you're suddenly punished because you're spending the extra time with patients. You're punished if you're going over things with them about, their life and other conditions that they have in parallel to whatever they came in for. All of this was, I was always punished by, doing this. And I was like, this is not why I went to medical school. I'm not here to serve or insurance or industry or whatever institution is trying to train me. I went to school to serve my patients. So this is not going to work out. So my husband is very brave, and he said, just, quit your job and do the extra training on what you want. So crazy man. Thank God for him.
We like a little crazy.
Yes, crazy. He's so smart. Then I joined a master's in personalized medicine at a pediatric hospital called Great Ormond Street in England. And they're very impressive. These people, kid come in with a very rare genetic disease. So they diagnose, so you learn how to do the genetic sequencing to collect the sample, analyze the raw data, then tailor treatment for that one kid, then do clinical trials for one kid, do all of that. And they just, sometimes a condition is a whole different new biology they have to study. So they would use organoids, stem cells. So I've learned with these amazing people who are very good at treating rare things and pediatric cancer. Pediatric cancer is so aggressive. So while I was doing that, COVID happened and I was pregnant. I got pregnant at that time and I had a miscarriage. So this is where things changed for me and got me to where I am now. Because I've understood during that time that a miscarriage means there's something off and nature is saying, this is not good. We're protecting you, we're protecting the baby. So nature has a way to tell us things. And I wanted to, my way, I guess, to cope with grief was because I lost my baby, we would talk to my baby every night. So that was very hard. And in the middle of COVID, who cares that you had a miscarriage? People didn't have time for what was going on. You go to hospital and you're having a miscarriage. No one has the time to look after you. My grief worked as my, motivated me to learn more. Dove really deep into the biology of fertility, miscarriage, what is that causes those things to happen, biology of cancer. And then I understood that everything is connected. Cancer, longevity, and fertility, they're all connected. So I've implemented a personalized protocol for me, one for my husband. It worked really well. We have a healthy little girl, best pregnancy I could ever dreamt to have. And then that became a business. So other doctors, other women and researchers who wanted to get pregnant, they came to me and became a private practice. And then my husband, so smart again, he was like, well, you need to scale this. One-to-one appointment is not, very scalable. So that's when he pushed me to look at the patterns. So we could use AI to put people into an algorithm and put people in categories of these genotypes and do things at scale. So this is what the product is. And this is where I am.
So you've practice in many different countries. And is there a different approach? Obviously, we know that there's different healthcare systems in every country for sure. But as far as like a functional medicine approach, do you find that happens more in other countries, more in the US? Is it gaining traction everywhere? What's your perspective on that?
This is a great question. Functional medicine, as with the name functional medicine, I find it to be it's an American thing, but also other countries have always had that, but with other names. Some Nordic countries, I know Switzerland, they would always have like a nutrigenomic approach or phytotherapy or naturopathic medicine. They would have creative ways to integrate this. I find that in Europe, there's a lot of attention given to what you eat from the healthcare and practitioner and population, but is never supported by the system, never supported by people's jobs, careers, the hospitals, the places where they work. Here you have that, although it's easy to say, oh, the American healthcare system. American has opened the doors for the globe to use this in a way that can be a business. They can have a name to it, that can be scientifically organized. And one of the most beautiful minds in this area is American, which is, Dr. Gundry, right?
Yes.
So Dr. Gundry talks about lectins, and then lectins are so important in the world of functional medicine. But he learned from another American physician called Dr. Peter Diadamo about what lectins are.
Mm-hmm.
When you test your blood type, the reagent is like these lectins in plants. That's how you test if someone is having a miscarriage. We have to see if your blood type is okay with the baby, This is how this is done. So Dr. Peter Diadamo has written so many books. The man is a genius in terms of genetics and glycobiology, which is so complicated. And he's been doing this for so many years. And Dr. Gundry, when I was watching one of his podcasts, he said, well, I've read Dr. Diadamo's books, all of them. And I'm like, okay, who is this guy?
Mm-hmm.
And I was privileged to also be trained by him to learn about clinical bioinformatics with him. This is 3 generations of American naturopathic doctors who have a very scientific mindset.
Mm-hmm.
The youngest one now is a woman. And I can't wait to see what she's going to come up with because she's so focused on the microbiome.
And what's her name, by the way? I'm just curious.
Emily Diadamo. Yeah. And she's on the East Coast. I have so much respect for her. She's younger than me, but she just knows so much. And so I've learned with her dad's, material a lot and his clinical bioinformatic tools. But his dad, as an American naturopathic physician, went to Europe to practice naturopathic medicine. And he saw the patterns and of what personalized naturopathic medicine is and brought to the US. And he started to make it as a business. Americans are very good at creating businesses, which is good because it can free a healthcare professional from the system. Because I am a mom, I want to have a quality of life. I want to come off the system. America is very good for that. So we need to also embrace the good things here and use it. So I think now this new generation is really into this and is happening globally. But everything is seen from our generation, you and me, and our parents. You see the difference in terms of what that system is. Mm-hmm. And the culture is also a future of how medicine is implemented, right? Mm-hmm. These new kids know it doesn't matter where they're from, where they are, they're all using these things. So I don't know if that answers your question.
No, it absolutely does. Absolutely. So you have the 2 businesses, one that you're currently building and the one that is operating now. Take me through, if someone were to work with you, take me through from start to finish start to encompassing it, what that journey looks like for them. How do they begin that?
Okay. You mean a patient, a client?
Yes. If a patient were to come to you, what would that look like for both of these?
So they can go to my website, they can book an appointment with me. Mm-hmm. And then I'll see what's going on with them, right? Mm-hmm. And that it's an hour. I don't, as my own business, I spend whatever time I want with my patient. So then I'll talk with you and try to understand everything about you, and we ask questions, we get to know each other. we're going to go over things. Then I will try to understand what is the best approach. Some people already have genetic testing done, microbiome testing done, functional medicine test labs with them. So then that makes it easier because they don't have to go do that. But let's assume that you don't have none of that. I don't have any preference for tests. So whatever you have with you, I'll work with, right? So after that appointment, we come up with a plan together. And if you need, then I need a genetic test because I need to look at network of genes. How's your oxidative stress situation in terms of, antioxidants? Your microbiome, your glycobiology, your hormones. How do you break down estrogen? It's very important. So I look at your vitamin D, so I look at all these networks of genes together. Labs, microbiome, whatever to support. After the call, I'll send the person an email with a plan. During the call, we will kind of agree on about what the journey is going to be like. Then you go do the test. I can send you links if you need. You book things, you do things. And once the results are back, I need a few days to go over things because there's a lot of data, especially the genetic one. The easy cases, I'll take at least 2-3 days to go over things. So I'll go over things, put maps together and create PDFs and put diagrams together for that patient. Then we book a follow-up call, and so that analyzing someone's data, it's a service that can be paid separately, of course, separate from the call, from the consultations. Then we book a follow-up call. That follow-up call, I like to record it because it's a lot of information.
Yeah.
So I want that patient to have always that as a resource for them to go back to, right? So we record and have an AI note taker writing everything that we're talking about. And I'll show that patient what those genes and what things are and what the plan is. And then that person after that goes, and then you can ask any questions, etc. And then you go home and have a lot of homework and things to do. Because what is it that your breakfast would look like? So I'll give you a list of food, things that are really beneficial for you, powerful for you, things to avoid. I have the 80-20% approach where when you're sick, try to follow what I'll tell you, at least 80% of it, right? When you're out with your family and socializing with your friends, just whatever.
Right.
We need to have a life and have fun. Okay. Unless you're pregnant, because some people
during that. Yeah.
Yes. So don't go drinking or smoking or, if you're pregnant or if you had miscarriages, I don't want you to have, if you're sensitive to tomatoes, don't eat that. Or, it might be chickpeas for you. It depends on the person. So especially in the beginning of pregnancy, but 80%, 20%. The person can ask me questions until they have this figured out. Now, the person will know what to do. They'll know how to look after themselves. They will have a plan. They'll have documents and resources because your biology is your biology. You can always go back to that. My idea is that people can be independent and not depend on me for this. However, I will always be there now after that as your personalized functional medicine doctor if you need me again. For example, because that person maybe had arthritis, and then, okay, Erika, I'm good now. But then later on, you're going to go through chemo or you have something else going on with you or a cancer treatment, something, or, you have surgery, whatever is going on with you, or you're pregnant. Then I'm going to go, you can book an appointment because I'll always have your genes and that material. And I can go back to that with a different plan. So I will look at different genes. Also, I can see from your genetic data all of the medications that you will, for example, automatically I will provide the patient with a list of medications that I know you have genes that will interact weirdly with those medications. So there's something called pharmacogenomics. So different medications will work different for different people. So we can always go back to that. And microbiome, it's a powerful thing because let's imagine everything is okay. You worked on your microbiome as well, because it's always part of the plan. But then if you want to be tested again, if you want to go back to that, because the microbiome will change, that will change, right? And if you had a course of antibiotics, let's just not panic about it. We can recover it. And microbiome, I have 2 ways. I have certain tests that, we can use, but also I like Viome a lot. Biome really empowers the person to be independent. You don't depend on your doctor. And this is very empowering for patients because you can always have a support because they've created this whole system for you to not need your doctor. And it's all based on transcriptomics, which is, it's very hands off for a clinician. So I can walk with the patient, I explain how that works and what that means, but then they should be free to look after themselves. Right. So that's it. So one appointment, analysis in between, and whatever follow-up calls you need, but at least one follow-up call with the results.
And with this model, do you see patients all over the country?
Yes, all over the country and in from different countries.
Yeah, different countries as
Yeah,
well.
yeah. Which is a bit hard because, you know, I need to sleep, but I try to work out with my husband. You know, sometimes he's on night duty if I have a toddler, and then we just take turns.
Right.
But yeah, but I like being able to work with people from different countries because it grounds you. Because in the US, you have all of these biotech tools for you. Suddenly you go somewhere where people don't have access to their genetic data. And I'm talking about rich countries where people are not allowed to have access to their genetic data. So I love navigating those things because it brings me back to real life a lot, and it's fun too.
You have to get a little more creative in those situations.
Yeah.
About what you can do.
Yeah.
And then with the other AI platform business that you're growing, you said that, you know, you can kind of categorize people into mostly 6 genotypes. How do you actually do that? Is it a blood test that you utilize? Is that what you use as the base for that?
I like you. I love this. I love talking to smart people. Okay, so great question. So I ask a few questions, first of all, but I need to know a few things about you. You may need a blood test or two, or you may already have them, because when you're going to answer the questions, I might ask, I don't know, what's your status for this? Folate levels. You know, there are certain questions that I may ask that you may need to get that information from a lab, in case you don't know or you don't have that. And biometrics. So I will use also something it's called your glycobiology in that algorithm, and biometrics. So it turns out when your mom was pregnant with you, that changed a lot of things about your biology and your metabolism. And that is so proven scientifically for decades, and I don't understand how this is not common knowledge. For example, these genotypes are based on the epigenetics of pregnancy. This is why I'm so passionate about working with future parents, because you can change the epigenetic story of the next generation. Right. So I will measure you, like you go in front of a camera, and we'll measure a few things about body parts, different parts of your face. We can do fingerprints. We do different things. And my co-founder is a doctor who is an AI engineer for that. And he is the one who has been implementing this. You put those things together. There is a whole thing called DOHAD, which is a scientific group of researchers across the globe who collects the data on this, right? And we've been doing for generations, where you put these things and tells this person is someone who's going to have issues with sugar. This one, we have issues, we have a very overactive immune system, and that's the big issue. This other one, immune system is quite lazy, and that's why you have lots of these little cancers coming up. So we really need to work on that part of this person. So these things are very solid, and we can predict with this. So it's not like your genes, which is, you know, the closest that we can get to, like, you know, 1-to-1, but it's good enough in comparison to what we have now. What we have now is nothing. It's a general approach. So it's good enough. And the idea is, I don't know, like my co-founder is going to kill me, but the truth is that I don't know exactly how we're going to charge, if it's going to be $10 a month or $20 a month, but it's affordable for you to have, you know, be put into this calculator where you're going to have food lists, supplement lists, you know, AI coach checking with you. Did you take this in the morning? Did you take this? You done this? It's great. I would pay for that.
Yes. So it'll be like a membership type thing where they'll pay monthly to be part of this program and have access to all of those tools. Do you have a launch date in mind, roughly?
Yeah. So we're planning to have this online in 2 months.
Okay.
Yeah, we got a little support from Google
Uh-huh.
as well, which I'm very excited because we've been self-funded, right? So we've got a little support from Google because we're using a lot of AI and storage, and our engineer works well with Google. And the idea, would be within 2 months. And also about the membership, it's a membership, but you use as long as you want.
Mm-hmm.
Like if you're like, oh, I'm fine, I don't need this anymore, you just, cancel it. Because I really don't like feeling like I'm forced to do certain things. Maybe it's a very European thing. But so the idea, like it's, and if you, for longevity, you can use that for longevity, but also if you're trying to conceive, I would recommend that someone start as early as they can, because it really has an impact in the outcome of, the quality of the eggs. And during pregnancy, many of people who use my recommendations use them a lot during pregnancy and when they're breastfeeding, or, to help the kids' microbiome, etc. And all of this journey is very powerful. And I would like people to, at least, if you're trying to conceive, to try keep all the way to before pregnancy, during, and when you're breastfeeding. But for the rest of us, it's, for as long as you're feeling good about yourself.
I don't know if people really, there's been a little bit of conversation about fertility issues in general. And it's not just that people are choosing to wait to conceive because of a host of reasons, but then when they actually are trying, even if they're not waiting, the conversation, I have kids in my 20s, they're in their 20s and 30s, and so they're really in that sweet spot. And a lot of their friends, the amount of their friends that struggle to get pregnant is so different than when I was going through that, for a host of reasons. So what you are bringing light to and offering is so timely. And I mean, not to sound too hyperbolic, but like our species depends upon this. I don't mean to sound so dramatic about it, but it is the truth. And I mean, I think there's some issues going on, from what I understand, with the males and their struggles and how that is contributing to it, and certainly the females. And it really could be quite disastrous if we don't start getting a hand on that. And not only is it disastrous on a macro level, but it's personally devastating on a personal level when people are trying, or experiencing the miscarriages and not understanding that there's no blame, but maybe there's some control, right? Like there may be some things that you can really, really do if that is what your goal is. So
it's I love that you say that.
So wonderful what you're doing, and the hope and just joy that you're going to be, are currently and will continue to bring to people. So really kudos for that.
Thank you. Thanks for saying that.
What are some of the biggest challenges that you've faced in building these two different businesses from a business perspective?
Yeah. So first of all, thanks for what you just said. So nice. I think there's nothing more important than like the health of the next generation and our kids, because our kids are going to have kids, and that it's them navigating those things. And the medical system doesn't empower them. I was there myself. I froze my eggs before I understood all of these things. I would not use those eggs, by the way. I used eggs, older eggs, 10 years older. But I know those eggs were in better shape because of what I know now. So it's so important that you're saying that. And it comes to one of the challenges. So one of the challenges I find is that, so for example, my husband he's used to tech and this whole thing about startup or raising. That's not me. I'm just so medical. I'll do everything for free if I could. It's like, you're going to start it. Okay. I'll die happy, like of hunger, but happy. But yeah, he's very good at that stuff. And he's seen this change now. Raising money for tech products and things is not the same as it was before because of what AI is now, right? So everyone, especially here in Silicon Valley, is panicking. I'm glad we haven't got funding when we started, because now I would be like, whoa, I have now to give money back to these investors, but AI is replacing a lot of the things that you should be using funding for. They have AI now, but AI is good for people who are self-funded, because of the tools. So one of the challenges for me is that you go pitch to these startup funds who do not see the world the way you just told me, that this is so important. They don't care about fertility. I tell them these things. They don't understand how serious and important here's this is. They were like, not sure we care about that stuff. This is not cool enough.
Mm-hmm.
I think this is the most important fight.
It's the most important thing.
Yeah.
Yeah.
We're seeing epigenetic changes is documented, changes generations after generations now. From, all the way from Civil War, trauma, lack of certain nutrients. It's there documented. Pediatric cancer, in my opinion, shouldn't exist. Our environment and what we eat in our microbiome and the toxins are killing us and giving us cancer and making our kids sick. And there's nothing worse. Miscarriage is bad, but let me tell you, there's nothing worse. Well, seeing your kids sick. So I'll do anything to prevent that. So I think this is the most important thing, fight. And overlaps with nature, looking after nature, because if you're looking after our exposome and fertility, you're looking after the planet too. So it's right there. It's a win-win. I think this is the big fight, but I don't feel like when you're there pitching, now you have this elevator pitch, whatever that means. You have 3 minutes to pitch your idea. How can I pitch this in 3 minutes? This is too complicated for guys. Oh, I'm sorry. There's lots of good guys out there. I don't mean that. People who maybe don't think this is an important fight. So I find that hard. And I'm not built for that. So I'm glad we're self-funded because I can't. I could be raising loads of, trying to be pitching, raising money. I just can't. Trying to convince someone who doesn't understand how serious this is. That's one aspect. For the private practice, I don't think that it's an easy one for me. It's easy to do that work. You don't need, so actually, if I'm doing in the US, it's easier. If I'm doing certain countries where regulations control so much how people don't have access to their own labs and results, that is hard. I don't have control over that. And that makes me very angry. That's hard for me. The other thing is that work I wish I could do for free, but now I have to charge because I was trained in a public system, in a public hospital. And that is something for me that's hard, but I have to charge. But the other doctors that I'm working with, they're good at telling me that, no, we have to charge because we won't be able to pay the bills. So I have other people to help me get real a little bit. So those are things that are hard for me to navigate. Charging and how the discrepancies of how people are allowed to have access to their own data for the private practice. Does that answer your question?
Yeah, no, it absolutely does. I know that's been surprising to me navigating the American health system sometimes, how I would have to beg to get my own results.
It's insane.
And fill out a form for that and beat them down for that to have access to it in certain scenarios.
Oh my gosh.
So let's talk about the future. Like that's the struggles and some of the things that you've overcome. But obviously the AI company that you're building out 2 months away from launch. And do you have a name for that at this point already?
Yeah. So it's Rejuven. Rejuven Health is our website, is what the company is. And the app is Rejuven AI.
And then what's the name of the company that you have with the other doctors that you're working with globally?
Yeah, that's a great point.
Or how would people be able to find you, I guess, through that?
Yeah, I'll have my own website. So it's Dr. Erika Tajra. We can put the link so someone can just go there and book an appointment. But also I work with these local clinicians, for example. There's Akira Health, which is in LA. The doctor I told you, she's amazing with like, if you need your peptides, your weight loss medications, and you need your skin. She's amazing with skin stuff, especially if people just don't want to be doing plastic surgery. She knows all of these new Korean things and the machines and the ultrasounds and the I didn't even know these things existed. She's amazing at that. So through her website, Akira Health, which we can put it there, you can book appointments with me there. And people in the UK can book appointments with me at a clinic in England, the same in Barcelona, and the same in Lisbon. But I have my own website.
Gotcha.
Right. So I will put the links.
Okay, great. We'll have all that. Yeah, we'll have all that in the show notes so people can just really easily click on those links and be connected with you. So you're definitely building something that feels like a new model of medicine. And if everything works out the way that you envision, what does that look like in 5 or 10 years?
For us all, in terms of the
like for you as a business owner and what you're doing, but also more just from a macro perspective.
Yeah. Well, for me, I will just be excited to see things happening. I'm happy now. For me, is this to be able to have this consolidated and happening and see,
Mm-hmm.
more kids being born healthy and women being on top of their game in terms of health. But for us all, which I think is the most exciting thing, right?
Mm-hmm.
We have, so like, let's just think of the US for a moment. The US, we don't have enough doctors, right? However, you have about 20,000, I would say, international doctors trying to get into to work, and they're not matched into a training program or whatever the American system is. So this is insane. This makes no sense. We don't have enough doctors, but then that's happening. So this, what I'm doing with these other brave clinicians, is an alternative. So they don't give up on medicine, and they actually can go down this route. For them, this is exciting because they can be free and actually probably have a better life.
Mm-hmm.
But for us all is to have all of this information spread out, so prevention, so we're not reacting anymore, as in terms of what medicine is, should be reactive anymore. People will break arms, you have accidents and stuff.
Sure.
That's what doctors should be for, like
Yeah, the
hospitals should
acute
be
care.
for. Yeah. And that should be even be covered by, a cheap health insurance. It shouldn't be that expensive.
Mm-hmm.
Because we have so many chronic diseases, is not feasible. So if we all implement personalized, microbiome and longevity and functional medicine tools ourselves, and maybe what I'm doing will, validate that for the population, say, look, doctors are behind this. They understand that we can all prevent, and this is what should the future look like, is, this is the pattern of what my biology is. This is my genotype. This is kind of my biology. So if I live this way and I eat this way, I should have a long life, healthy, away from chronic disease, with strong prevention for like cancer prevention and preventing dementia, whatever your genes are showing that there's an association with Parkinson's or whatever. That's not relevant if you're preventing things. It's not. So no one should be scared of what you have a risk for Alzheimer's, whatever. If you're implementing functional medicine into your health in a personalized way, that would never be you. You never have Alzheimer's. So this is what the future is like. We're not going to get sick, and we can all enjoy life a bit more and do other things.
I think that's such a beautiful vision of the future, and people should be really encouraged that they actually have more control over that than they think.
Yes, it's all under our control.
That there's so many things that we don't have to just accept,
No.
especially when it comes to aging and our health, that there are so many things that we can. And I think people are becoming more aware of that now, thankfully.
Yeah.
Then the next step is actually taking the initiative to make the change, because sometimes people unfortunately are aware, but for whatever reason, it feels too big, too heavy, too hard.
Yeah.
So by you helping them just implement these things in baby step ways, it becomes so much more manageable, takes the fear out of it, removes a lot of those roadblocks, gives them a really clear roadmap. So I think what you're doing is just really beautiful. One of the things you said earlier was that fertility and longevity are deeply connected. So can you kind of explain what you mean by that?
Yes, I love that question. It's just so nice that someone is asking that question. They are, yes. Like, do you know that researcher, the Harvard researcher, what's his name? David Sinclair?
Okay.
He's really big. So he's a Harvard scientist that he's really famous in this world for longevity research. So everyone is watching what he's doing for, is he going to come up with a medication that will slow aging, etc., right? So he had a chat with someone, it was the podcast, where he said that he was talking a lot about ovary and aging of the ovaries. And I was so impressed to see that, because it's very related. So if you think about it, if you eat well and have a clean environment, etc., and you attacking the different variables that makes us sick or increase aging or speeds up aging, are the same things that also makes you infertile. So nature is set up in this way for different species, not just humans, where if, for example, there's a cost that we pay, nature is a little bit hard sometimes. If you having, for example, if you have lots of kids, sometimes that will cause you to age. Right? And if nature sees that your body is not fit for reproduction, it's like, okay, so we're done with you. So, and then you age. So attacking the variables that are making you age, which would be sleep, supplements the right nutrition, supporting your mitochondria, what we call the hallmarks of cancer. The hallmark, they're all the hallmarks of all of these things. They're biology, reproduction, cancer, they're all connected. So the mechanism by which we are fertile, we are healthy, we are well, and we're not aging. And hormones are an important thing. We're always scared of, and it's all about liability with the medical system. It's so ridiculous. No one wants to prescribe estrogens for someone because if that person has a risk of, for breast cancer, I understand their perspective and no one gives them the time to learn more. But actually, if you do bioidentical hormone replacement in a cyclic way that imitates nature, what is high and low. And there's a great doctor here who does that. It's called the Wiley protocol. She's so smart. And I think Dave Asprey talks. It's fine if you do that way. And then we should all be in the biological age and look for being in the biological age of your 30s. Whenever you see the data for IVF clinics where they don't want your eggs anymore, right? Which is when you're 34, they don't care anymore. So if you're 33, they'll take your eggs. Like if you want to donate eggs, they don't want your eggs if you're 34. Because it's the blind data without understanding the biology of things. Right? So we should all aim hormonally to be there.
In the early 30s.
Yes. If not, nature is like, okay, now you're going to age slowly. We decided to live longer. If we hadn't, we wouldn't have created antibiotic, right? If we made that decision, I don't want to be really sick when I'm older. So that's what I'm going for.
Yes.
Staying right there. And that's it. And that's why we see a lot of teenagers is struggling now in terms of their hormonal health. It's a clue that they should work on those variables and that their hormones should all go back to fine, normal. And it will work for anything, for their health, their well-being, their mental health, one day their fertility. And this goes for any age. It's the same variables, they all overlap.
It's all connected there. Well, thank you. It kind of explains that really beautifully. Obviously, you're using AI in a lot of ways. I mean, your whole new platform is going to be based on that. But there's obviously some components that AI will never replace, particularly in medicine. And I always hope the goal of what we're doing with my company, Soaring Solutions, is provide support on the back end and help reduce tedious tasks, maybe compress data, implement systems that help workflow so that it can free up. Because like you said in the very beginning, you are always being punished for taking more time and utilizing that human element, which we're all craving so much. So it's exciting to see you put these two pieces together beautifully like you are. Is there some other component right now of either of your businesses that you wish you could hand off to AI and just take off your plate so that you wouldn't have to do that anymore? Yeah. And what would those be?
All the time. What can I say? This is the beauty of working for myself, that I can do it. If I was in a hospital, I couldn't be doing those tools. And here they are. Where do I start? Talking with you, Riverside, we use AI tools. Helping us organize information using generative AI, ChatGPT. It's very important to have things kind of structured. I don't need to talk about ChatGPT, right? It's so important, generative AI. But note-taking. Note-taking for a doctor is so important. For a doctor, for a nurse, for any healthcare professional. And you would not believe how in hospital, in many hospitals, we're not allowed to do that. Especially early in your career. I spoke with another mom she's training for family medicine for a very posh, hospital here in California. And she told me, no, I'm not allowed to use AI for my notes because I'm supposed to learn to write my notes. The woman, she's a mature student. She has a medical degree. She's a mom. She barely sees her kid. And that's so patronizing. I was so annoyed. Yeah. So she can't pick up her kid and see her kid. But then because they want to force her to be writing notes, notes that are lost. And how can you integrate things so your primary care physician can see what your oncologist is doing? All of those things. And that support for a patient in terms of let's be honest, buying supplements and knowing what to do, navigating those things, simplifying those things for the day-to-day tasks, us to implement, what functional health is. We need AI.
Mm-hmm.
So I don't even know. AI needs to be everywhere.
I find that actually, when I'm doing Zooms and things like that, and I have my note taker in the background, I'm actually paying much more attention to the actual conversation, because I'm not having to think about listening while I'm writing. I mean, I might still jot a note or two just to have it be in the forefront, but I feel like I'm much more engaged and really hearing the person, and the conversation is evolving more, and I'm thinking of the next question instead of making sure I got down what they just said. And then the beautiful thing is, if you do forget something, you need to just go back and listen to it and clarify. Yeah. And then all that is compressed into a little transcript, where that would have taken me forever to
It's the
write
same
it
for
out.
you.
Yeah.
It's the same. I can pay attention to that patient. I can look at them in the eye. I can hold their hand. I can give them a hug.
Mm-hmm.
If we're in person, we can truly be there for each other, because there's something writing notes. The notes are important. What medications are you taking? All those things are there. They're important, but I can connect with you, and that is amazing. That is the most precious thing that we have. And AI can give me that, can allow me to be human. Why is it that I'm not allowed to do that in a hospital?
Mm-hmm. Hopefully that, like, a few years from now, they'll look back and say, can you believe we ever did that? That was so silly that we didn't allow that.
I know.
Sometimes change is hard, and some institutions are really dug in, and I understand being cautious. It's
Yeah.
there are things, and we have HIPAA and other things that we have to be concerned about when you're talking about the medical field in particular. So
Yeah.
it's
Yeah.
the guardrails up, but
I
yeah.
know. But we need to be responsible, and let's assume that we all are, because at the end of the day, let's assume that liability was not an issue, that people wasn't, there wasn't this thing, I'm going to sue you for this or whatever.
Mm-hmm.
But you can take someone to court if that person caused you harm, and that's important. But I don't want to hurt anyone. So, like, protecting someone's information, their privacy, those things need to be there, because I care about what I do. I care about you. I care about my job.
Mm-hmm.
So big time. We need that. We need to make sure we have all of that to start with, because people trust you, and yeah, it's 100%. Yeah.
I wanted to bring it back to the fertility issue just for a minute. I had a couple of questions. Do you think that there are two or three things that women in particular, or women and men, couples, and I know that each case is slightly different, but you obviously are seeing trends and patterns and things.
Yeah.
Are there a couple of things that you could say that they could do before they get pregnant that a lot of people may just be overlooking at this point?
Yeah. Yeah. Okay. That's very easy. Okay. Don't take folic acid. Take folate. I don't even know why this is still legal. That's one. Very important. Take B12. Check your B12. These things are together, and they're very important. If you have, there you go, Dr. Peter Diadamo. The man is a genius. He has figured out that people who are blood type A have very low. Are you?
Yeah, I'm A negative, actually.
Oh,
Yep.
okay. So we need to talk. I have some stuff for you. I have some information for you. It's really interesting that man never gets it wrong. So is my child. Oh, but my child is A. Your stomach, so the level of acid in your stomach is lower. So someone, also you have amazing neurotransmitters, right? So you guys are super smart, but and you're less likely a lot of the time to be depressed, because you have these neurotransmitters kind of there, and you're not so dependent on animal meat. Of course we still need animal meat, but you're not someone that you're forced to be eating red meat or whatever, which unfortunately I have to, based on my genotype. But for example, if you're blood type A, your stomach acid is lower, so be careful with monitoring your B12. Again, fertility and cancer are there together, hand by hand. So your body needs these things to be supporting DNA and the health of your cells. So we all should have good levels of B12 and folate, all the B vitamins, the methylated kind of bioavailable B vitamins. But I never want anyone to try to conceive if they're not doing those two, right? Okay. Vitamin D with K. Right? Those, make sure your thyroid is at a functional medicine level, not a pathology level that a normal doctor would look at, because it's not their fault. They have to follow those rules, otherwise they are punished, right? So, and try to support your thyroid naturally first before just giving thyroid medication. But if you need that, you need that. So those things need to be there. And that's number one.
Okay. Great
Number
tip.
two, yeah. Number two, well, we're talking about vitamin D. If a person can take from the sun, of
Mm-hmm.
course, better, but it doesn't matter. Take your pills, and K2 needs to be there. Grass fed, the K2 idea is think about grass fed, eggs that are from chicken, they're grass fed or pasture raised,
That's
not grass
great.
fed. They don't eat grass, right? But they're pasture raised. Yeah. So it is a thing, right? What you eat is grass fed. You will have Katie. Right. Okay. I'm going to tell that to my mom. We were talking about chickens yesterday. Fine. So that is very important. But work on your microbiome, support your microbiome. So before starting on supplements like probiotics, feed what that thing needs to eat first, like the prebiotic fiber. So if you go to ChatGPT, so fertility, right? And that goes for breast cancer, etc. as well. Think that if you want to support lactobacillus and bifido infantis, ask ChatGPT, how do I support this bug? These there linked to fertility. And then you say this fiber, this fiber, this fiber, and start slowly.
Mm-hmm.
Again, if you're blood type A, you have to be careful with dosing up with loads of fiber. You have to go slowly, right? So work on your microbiome, vaginal microbiome and your gut microbiome. You have great tools. You have Evie for in the US for vaginal microbiome. They're quite good. And we have loads of companies here. It's great. So microbiome, those things that I told you, those supplements to start with, and support your mitochondria. So coenzyme Q10, I prefer ubiquinol. Do that. Same for longevity and fertility, right? Do those things, support those things. And try to eat, be careful with the lectins that you eat. Don't avoid all lectins because some lectins help you fight cancer. So the best way, the easy way for you to kind of don't feel overwhelmed. This is a lot of stuff, right? Read the books by Dr. Peter Diadamo, the Eat Right for Your Type, and see what lectins support your blood type, because some will support your body to fight cancer and some will decrease inflammation. Do those things. Those things, it's amazing. If you're doing those things, it's a great start. Then if you want to do IVF or if you do other things, fine. But at least you'll be safe. You'll make sure that pregnancy is doing well. I am a big fan of omega-3 as well, DHA by Nordic Naturals, because it's clean. It's a clean type of fish oil. Okay. Does that help? Because I can go on forever.
I think that's some really solid, actionable tips, things that people can do without overwhelming, that could make all the difference, and it's a great start, and it may be just enough for some people.
Maybe it's enough.
It might be enough, but if not, it's certainly not hurting, and it's putting them on the right path.
Yeah. They'll feel better if you have, aches from when you get your period. You'll see lots of things get better while you're just thinking you work on your fertility, but actually you're getting healthier.
Yes.
So you have nothing to lose.
Yes. Well, Dr. Erika, this has been such an amazing conversation. I feel like we could talk forever. There's so many more things, and so exciting to see what you're currently doing and what you have, in your very near future coming up. We're excited to watch and follow along and to become a member of that and take that with it. I think that you're helping so many people now, and your outreach is going to be just really exponential once you have launched that new platform. So really excited to see where that goes, because the affordability issue, like you said, you wish you could do things for free. And that's such the heart of a pure doctor. My father-in-law, who recently passed away, an amazing cancer surgeon and horrible businessman. He didn't care at all, much to like the disappointment of some of the people in his life. But he saved so many people's lives, and that is the true spirit of medicine. But the reality is, this is the world that we live in, and you deserve to keep a roof over your head and support, pay the bills to keep these things running. So don't be afraid of that. But to hear you making it so much more affordable, when really that is so, especially in America, that is the thing that really prevents people from being able to get good care. So it's so encouraging to see people like you taking control of these things, offering solutions real solid solutions that are really going to change the way, because we just can't keep as a society going down the path we
No.
are now. It's completely unsustainable, and I think we've already reached the breaking point. So very,
Yeah.
very encouraging to see these
Thank you.
new situations evolve. So I applaud you for that. I'm excited to be a part of that, and encouraging everyone in my circle to pay attention to all of that and follow you along on that journey.
Thank
Thank
you
you,
so
thank you,
much.
thank you. We're going to put all of the information in the show notes so that they'll have the links to link up with you directly and start to follow you along as you get ready to launch the other platform as well. So I really, really
Thank
appreciate your
you.
time today. Any last little closing things that you'd like to put out there before we wrap this up?
Yes. So, first of all, thank you so much for your words. They mean a lot to me. It's loved talking to you. So if you ever come here to California, please just give me a shout.
Absolutely.
I would love to meet you and give you a hug.
Absolutely.
People, I would love. So what you're doing is what I want to see happening. You ask questions that at the end of I was able to tell, do these things, because these are big things for your biology. We shouldn't be sick. We should look at the price of housing. Houses are so expensive. They have so many things that we have to deal with. So let's not be sick. So what you're doing here, listening to me, talking to me, being interested, is empowering me as well. So we can deliver this information for a lot of people so they can help themselves. They can listen to this and then start digging and searching themselves and reading these books themselves and helping themselves. And this is huge. So I just want to say thank you for this, for doing this.
Yeah, it is my
Very
pleasure.
important. Yeah.
Truly.
And it's great. So I just want to say thank you. And everyone, just take control of your own health. It's okay. And it might feel overwhelming, but after a while, you figure out, you see patterns, and it becomes very simple. This is all I have to say. So it's okay. It's just the beginning, is a learning curve. It's the same when you, as a medical student, there's a lot of moments where you're like, oh my God, this is so much. Then you go over again and again and again. In everything in the world, there's a pattern. You start seeing and you get comfortable and it becomes part of your life. So knowing what to eat and how to live in about exposome and chemicals, it has to be part of our lives. It's not my job to do. I'm having to do that job now, but hopefully it's not going to be the doctor's job to be doing this. We should all know these things. That's all.
And if not putting the effort into our health, what's more important than that? There's really nothing more important than that. So thanks again. And we really appreciate your time today. And we are all looking forward to seeing the amazing things that you are continuing to do.
Thank you so much.
Thank you.
Thank you.